Introduction: Debunking Snoring Myths.
Snoring is a common issue that affects millions, but there are many myths and misunderstandings about its causes and solutions. In this video, we'll explore the top 5 most persistent myths about snoring and reveal what actually works to reduce or stop it. Get ready to learn the truth and discover practical tips for better sleep.
Myth 1. Only older or overweight people snore.
Snoring can affect anyone regardless of age or body type. While age and excess weight do increase the risk, young and slender people also snore, sometimes due to genetics, nasal issues, or sleep position. If you or someone you know snores, don't dismiss it based on age or body size. Snoring is more common and complex than people often think.
Myth 2. Snoring is harmless.
Contrary to this myth, snoring isn't always harmless. Regular, loud snoring may signal underlying problems, such as sleep apnea, which can lead to health risks like high blood pressure and heart disease. If snoring interrupts breathing or causes fatigue during the day, it's important to consult a healthcare professional for evaluation and support.
Myth 3. Alcohol helps you sleep better.
Alcohol before bed can actually make snoring worse. It relaxes the muscles in the throat, making it more likely that airways will become partially blocked and create the vibration of snoring. For those who want quieter nights, avoiding alcohol in the evening is a proven way to reduce snoring and improve sleep quality.
Myth 4. All snore-stopping devices work equally well.
Not every product on the market truly helps. There are many anti-snoring devices, but their effectiveness varies greatly. Evidence shows that custom-fitted mouthpieces and positional aids can be beneficial for some people. However, over-the-counter solutions, like nasal strips, might only help in mild cases or not at all.
Myth 5. Surgery is the only solution.
Surgery is rarely the first or only answer for snoring. Most doctors recommend lifestyle changes first, such as losing weight, sleeping on your side, managing allergies, and avoiding alcohol. Continuous positive airway pressure, or CPAP, may be advised for sleep apnea. Surgery is reserved for the most severe or treatment-resistant cases.
What actually helps with snoring?
To address snoring effectively, focus on proven strategies. Maintain a healthy weight, sleep on your side, address nasal congestion, avoid alcohol before bed, and talk to a doctor if symptoms persist. For many, small changes can bring big improvements. Remember, understanding the facts is the first step to better, quieter sleep.